An estimated 4 to 7 million Americans are affected by a crippling inner ear disorder known as Meniere's disease. It causes deafness, ringing in the ears, and progressively severe vertigo, a dizziness type. Now, we have with us today a doctor who hasn't found a cure for the disease, but he has found a solution to the problem, an inner ear valve implant that's close to 90% effective. Joining us now, Dr. Irv Ehrenberg, and also with him, Larry Weber, who had the operation. Thanks for joining us, gentlemen. Before we get into, Larry, the operation that you had, let's talk about how you got involved with finding the solution for this disease.
Well, the problem has been around for a long time, and it affects a large number of people in the United States. The solutions prior to the 1960s was to destroy the inner ear to get rid of the episodic vertigo. The patient also lost all of their hearing as a result of this destructive surgery. The fellow who figured out that destructive surgery was knighted by the King of England. We've made some progress since then, and we can now not only get rid of the vertigo in a substantial number of patients, but we can also actually improve a sensory nerve type hearing loss in some patients. The success rate isn't where I'd like it to be, but it's continuing to improve as the technique is refined.
Larry, let's talk about Larry. He first came to you 3 years ago. It's been 3 years since you've had this operation, Larry.
Correct.
Tell us what the difference is now as it was to 3 years before this.
Well, let me tell you a little bit about the Meniere's itself. It's very crippling to an individual because you don't have very good balance, you're very nauseated, you're very dizzy. And as a result, I saw Dr. Ehrenberg 3 years ago, and I asked him to help me because I knew a little bit about it. I've had problems with it for about 15 years now. But what we've done is, or what we have now is I have the valve implant that was done 3 years ago. And as a result of this valve implant, when I came to see Dr. Ehrenberg, I was just about completely deaf on my left ear. And having the vertigo and the serious illnesses as a result of it, I'd get sick at work, etc. And people have to bring me home. They thought I had a problem with alcohol or some other situation. But anyway, Dr. Ehrenberg put the valve in, and as a result, my hearing is better now. And I haven't gone through the serious vertigo attacks that I was having before.
How much better?
I'd say 50% better than it was.
You have a model here of the ear implant. Maybe you can show us that. It's really small, so you can just hold that up for us and talk to us a little bit about that.
This is a inner ear valve implant model. The real valve is on the end of this needle and is inserted into the inner ear.
So this, let's see, let's hold that up. This part right here?
Well, the capillary tube part is inserted into the inner ear itself. The problem in Meniere's disease is an excess buildup of fluid in the inner ear, similar to glaucoma in the eye. When the fluid under pressure builds up in the eye, with glaucoma, the vision goes down. When the fluid in the inner ear builds up under pressure, the hearing can go down if it's in the hearing part of the inner ear, or if it's in the balance part of the inner ear, they can have balance problems. If the membranes rupture with the excess pressure, then they can have the acute attacks of vertigo, such as Mr. Weber had. The valve implant is primed with heparin solution and is put into the inner ear, and I guess we'll see a segment of that.
Yeah, let's go to the tape right now. We can look at it, how it's actually done.
This is the part that you'll see being inserted into the endolymphatic sac, which is a part of the inner ear.
Okay, here we go. Maybe you can tell us about this, what we're seeing here.
On the left, you can see this portion of the valve implant in a special instrument, and it just got inserted into it. There's a lot more to the surgery than what you're seeing. This is just literally the tail end of it. And you can see the bulk of the valve implant here. And that instrument is sliding it in and cannulating it after it's been properly measured so that it seats. And then you have a fluid-fluid interface between the excess fluid in the inner ear under pressure, and this is basically an escape valve. It doesn't cure the underlying cause of the fluid buildup in the inner ear, but it takes the excess fluid under pressure and removes it from a place where it's damaging the sensory hair cells, nerve endings, to a place where it's not causing damage.
Okay, now that we basically know what the disease is all about and what your operation is involving, let's talk about you. You actually perform this operation for people from all over the world. They come to see you. Tell us a little bit about your background. You've actually done a lot for this.
Yes, as far as the patient population, I think we've done somewhere around 750 valve implants on people from over 40 different states or provinces of Canada and a few from outside the United States. So other doctors usually send their more difficult cases or revisions or medical treatment failures. And for example, Mr. Weber had a inner ear operation 8 years prior to my seeing him, which helped with the vertigo, but which did nothing for his hearing loss. And then when the vertigo recurred, then he came to me, and I told him I might even be able to help his hearing, and he thought that was rather humorous.
Mm-hmm. You didn't believe him?
Absolutely not.
Why
All
is
that I
that?
wanted to do was make sure that something was done with the vertigo that I was experiencing.
So that was the least of your worries, the hearing. You just wanted to take care of that.
But what a difference I've seen since that actual operation.
Sure. Did people believe you? In some of the stuff I've been researching about this disease, a lot of doctors aren't able to diagnose it at first, and they're not even sure what it is, and so it could be a while before you actually know what you have. Did you know, in fact, what was wrong with you?
Well, I did, because I went to one of Dr. Ehrenberg's associates, but I know a lot of people that have no idea, and for years and years they go from doctor to doctor, spending time, not really understanding what the disease is. I was fortunate. I was one of the few that were very fortunate. I know people that have been to 10 different doctors and have not been able to come up with a diagnosis.
Now, when he first told you that he might be able to give you back some of your hearing, and you said you kind of laughed him off because you didn't believe it, what did it feel like a couple of days after the surgery? What were you expecting? Were you optimistic at that point?
Well, it was kind of interesting, because I live in Casper, Wyoming, and my wife the next morning drove me back, which will give you an idea of the type of operation it was, and I didn't have very much hearing, if any, initially, but it started coming back, and it comes back very, very gradual.
And so he's just one of the many success stories, too. As we were saying, this isn't a cure, but you found a solution, and you've performed thousands of these operations since
Not
the first...
thousands.
Hundreds of these, I should say, operations since you actually did it the first time 11 years ago. How far have we come since that first operation that you performed?
Well, I think quite a ways, because when we first did this operation, I was in Sweden as a visiting scientist of the Swedish Medical Research Council, and also on a special award from the National Institute of Health in the United States. And the common procedure at that time was to destroy the hearing and the entire inner ear to get rid of the vertigo. And one of the reasons I went there was I had done some surgeries that preceded this valve implant, and the prototypes for the valve implant became available. And so the professor there was going to do some of the cases, was going to destroy these people's inner ear, and he thought that with this valve implant wasn't going to do any more damage than they were going to do on purpose. And
so he figured, why not? But little did he know.
And it turned out much better than anybody would have predicted, including myself. The patients had a dehydration test, which shows what happens to the hair cells in the inner ear when the pressure is reduced. And in some cases, approximately half of the people who don't realize they still have a reversible component to their hearing can actually get improvement in their hearing during the testing. And this is a very good prognostic indicator that they could get better from the surgery. And it was on the basis of this that I told Mr. Weber that, you know, we might be able to do something about his hearing as well as fix his vertigo.
Well, all I can say is we're really excited about your work and glad to have somebody like you researching this. And Larry, a great success story to have on.
Thank you very much.
Thanks for coming
I can
in.
tell you this, it's been exciting for me too, being part of it.
Good. Thank you very much. Thanks for joining us this morning.